So the only way we are going to tackle this virus is to get vaccinations in people's arms, and the quicker we do that, the quicker we will all get back to normal. So if you've been called, it's because you're in a priority group, and it's time critical that you come in and get your vaccination. It should take priority over everything, really, if you possibly can. Running the clinics is a challenge, and we have allocated a lot of time and resource to this. So if people can turn up on time and take up their appointment, it means that we can plan and we can get as many people in the priority groups vaccinated as quickly as possible and not waste any doses. So it's really important that you try to turn up on time and not early. The last thing we want is lots of elderly people queuing up, waiting outside, standing. We'd like you to come in on time, but don't turn up early to the centre. And it should be very slick and move through very quickly once you're here. Please don't call your GP, because practices will be overwhelmed with phone calls about that when they're trying to deal with emergencies and urgent care on the day. So you will be contacted in turn. We're working through the priority groups, starting with our over 80s, our care home workers, our care home residents, and our health and social care frontline staff. And as soon as we've done all of them, we'll move on to the next group, which will be our over 75s and people with other medical conditions who are shielding. So we'll work our way through the priority groups as per the government guidance. So please don't call your GP, we will call you. Because it's your best defence against coronavirus, even if you're fit and healthy, it also will help to protect your community, your elderly relatives, your work colleagues. It will help preserve our bed capacity within the NHS. And what we do know is that there are people who are young and fit who have been affected really severely by it, so we can't predict that, even though we know that older people normally have the worst effects from coronavirus. It does affect younger people as well.